Hey everybody, welcome to the Dr. Mom Show. It's Dr. D, mom of three. Thanks again for joining us. I hope you enjoyed our show last week about being pregnant and having a healthy pregnancy and making your body good for your baby or babies. Today we're going to be hitting on a topic that I feel is very important. It's called choosing the right pediatrician. Before I start talking about that, please remember to subscribe to the Dr. Mom Show channel. Don't forget, within the first month, all our subscribers will go into a pool and we'll have a random drawing. That will be to win a $150 Walmart card, so then you can go on a little shopping spree, whether it be for yourself or your baby. It's okay. Treat yourself. So, today I'm again talking about choosing the right pediatrician. How important is this? I feel like this is very important because one, you want a physician whose personality fits yours, whose personality fits your family. Also, you want somebody who you feel you can talk to, you feel comfortable asking questions to, whether it be about vaccines, your child's care, something simple as a rash. So you want somebody who you can sit down and talk to, not somebody who dictates the conversation when you go to your visits. The other thing is you want somebody who fits into your family, like I said, personality-wise. So for example, I love to have what I tell my parents, a 1-minute TLC time during their physical or well child check. So during my 1-minute love time, I just love and squeeze my babies. They get some kisses. Sometimes we even dance.
Ring around the rosy, pocket full of posies. Ashes, ashes, we are for Yay!
And I beatboxed a little. You didn't know I could beatbox, did you? Maybe I'll give you a little sample in another show. But usually I just love and squeeze my baby, so I let the parents know. Now I will say maybe there's some parents where they're like, oh, I don't want this doctor touching my baby. So then I'm not the pediatrician who they would pick, but there are some families who are like, hey, you know, I really like a pediatrician who gets down there and who holds my baby and who loves on my baby. One thing I'd like you to know is a lot of offices of pediatricians and family medicine doctors have what's called a prenatal meet and greet visit. What this entails is the visit is made through the mother, and either just mom or mom and dad or mom and another family member can go to this visit. This visit usually is free, and what it is that you go in, you can get a tour of the clinic, and this helps because you can see if the clinic is kid friendly, because you don't want to go in a clinic that's like boring and drab, that when every time your child goes there they're like, oh my gosh, this is a Twilight Zone. You really want something that's friendly. Maybe they have a Disney theme. Some offices have an aquarium. Some of them have games and a little play area that the kids can hang out. So this makes the kids more excited when they get there and they aren't as afraid to go to the doctor's office. The other thing is, during these visits, you get to meet the staff, and you also get to meet the physician or the physicians who practice in that office. Again, this is nice because you can get a feel of how you interact with these people and how their response to you is. Another important thing is asking questions about the clinic and how it's ran. So for example, things like, what are the hours of the clinic? How does the doctor or the doctors take call? If when you call at night, we call these calls mommy calls, that if something's wrong with your baby or you have a question after clinic hours, who will take those calls? Will it be your physician? Will it be a different physician? Will it be a nurse? So those are important things. Also, another important question is whether your child's physician rounds in the hospital. So for example, if your baby is born in the nursery, some doctors don't see the babies while they're in the hospital. Some do. Some doctors, if your child gets sick when they're older and they're admitted to the hospital, some physicians see their own patients in the hospital and some of them don't. So again, these are all questions. Another important thing is finding out that that clinic or physician takes your insurance. Of course, that is very important because you don't want to establish your child there and you feel comfortable, or your child feels comfortable with them, and then all of a sudden you find out that that clinic doesn't take your insurance. At those visits, usually we can't give medical advice, so just please be aware of that. So if you have specific questions, because the visit is free, it's not meant to get medical advice, but you can sometimes ask, you know, the physicians, what's your stance on different things. So for example, with vaccines, some doctors say that if you don't want any vaccines, usually they don't accept those patients, while there's other physicians who are more flexible, and that will be another topic, so please stay tuned. So I hope you enjoyed this. Again, picking a pediatrician is very important. If you have any other questions about a prenatal meet and greet visit, please comment or ask your questions. And of course, feel free to call your local physician doctor's office to ask them if they offer it. Also, I would recommend that you go to more than one prenatal meet and greet so you can talk to as many physicians as possible. The other thing is about the time frame to do this would be best in your third trimester. So probably when you're around 30 to 32 weeks, where you know the pregnancy has been going well and you're not as stressed out as about how the baby's doing. Well, again, I hope you enjoyed the show. We have a special visit from the Tripsies today, a special clip, I should say. They'll be making an appearance at some point. We'll keep that as a surprise. Again, don't forget to subscribe to our channel, and don't forget to wash your hands, kiss your kids, love your family, and say your prayers. Thanks again. Bye-bye.